Okay, so I have an assignment, and it has to talk about the difference between sex and gender. Okay? It's gonna be a gender-based medication assignment. And do we always think that sex and gender have anything pertaining when it comes to medications?
Yes.
You do? So, let's start off with a joke real quick. This little girl went up to her mom and said, "Mom, I need to know about sex." And the mom was all like, "You're only 8 years old. What do you mean you need to know about sex? It's for an assignment for school, and I have to know about sex. I need to know what to put down for sex." So the mom went on explaining about the men and the women and how they needed to be intimate, the different parts of men and women and how they worked in their body. After she went on for about half an hour and she felt she did an amazing job of explaining this to her daughter without actually being too revealing, the little girl looked at her and said, "Mom, that's a big answer. I just need to know what to put in this little section." And the mom started laughing. She goes, "Oh, you mean female?" "Yes." Get it? Get it? That was so fake. So, what do you guys think sex is? I know you're reading it.
It's when we're assigned at birth.
Yes. This is what we actually think about. It's our properties, the qualities in which organisms. We're female, male, right? Our reproductive system, our characteristics, whatever we're given at birth. Gender, on the other hand, we don't say male, female. We consider it masculinity and femininity. This is how we perceive ourselves, how people perceive us. We might have been born sexually male, but we feel we're female, male, depending on whatever we feel we want to be. That's gender-based. It can also be culturally based, right? Because depending on my culture. All right, medication metabolism. If I'm going to take some medication, is it going to affect me the same way as it would, let's say, Christian?
No.
No, right? Because male, female, and then even depending body weight, height, it all, age, I hate to say it, unfortunately, it all goes together. And so, if he takes a sleeping pill, and I take a sleeping pill, that's gonna be in my system longer. And that was actually brought up by the FDA. This happened with Ambien, and I know that we've gone over this on Ambien, right? And we talked about how you have to get a full 8 hours sleep, because if you don't, you can sleepwalk, and you get amnesia, and you have no idea what you did, right? We talked about this before. Well, Ambien, on the other hand, it turns out that women metabolize Ambien slower. If my husband were to take Ambien, he wakes up ready to go. If I took it at the same time he did, I metabolize it slower, so the body's in my system longer, which means I absorb more of it, which means I'm gonna have the effects longer. And this would be kind of like the first pass effect, the hepatic metabolism. Remember we talked about the first pass effect? The faster the first pass effect, the less you absorb. The slower the first pass effect, the more you absorb, type of thing. Now there's another example of some other medications. Aldosterone, this is actually for IBS. And for women, it takes care of it. If my husband has IBS and he takes this, it doesn't work. Which is amazing, because I would think if I take this, it should work for someone else. There's also Valsartan. This is for ulcerative colitis in adult men. Doesn't work for women. So we have to figure out what medications. Now my target base, and that's part of our project, is who am I going to talk to? I'm talking to you guys, future pharmacy technicians. How do we deal with patients? What if you were to see Debbie? Debbie walks in and she's got a prescription for Valsalazine. You know that it's for men. It's not gonna work for her. As a pharmacy technician, is that gonna cause you right away to get a red flag?
Yes.
What's the first thing that we need to do?
Alert the pharmacist.
Alert the pharmacist. I know we do have a scope of practice where we can't do like a lot of counseling because we can't do any counseling whatsoever. It's against rules. But we still need to know about our medications. So when it comes to women, when it comes to males, think about pregnant women, right? What medications can they not take? What medications can they take? Think about, this is all sex-based, male, female. Think about a transvestite coming in. How are you gonna handle that situation? You don't know? So handling that situation, I mean, you have a transvestite come in, biologically, sexually, if they were born male, they metabolize as male. And as they're going through the whole hormonal changes and pills and all of that, that's gonna take a little bit of effect because hormones also do metabolize medications differently. But unfortunately, we have to let our pharmacists know. Biologically, male, you might have to find an alternative. Something simple as we're just trying to do our best to get the medication that's going to fit you. Doesn't mean we have to tell them, oh no, you're a guy, you can't be taking this. Is that gonna become discriminatory?
Mm-hmm.
Yeah. So we have to learn how to handle this properly by, you know what, let me get some information from my pharmacist because I want to give you the best possible care. And I understand that biologically this might be I can't even tell him that because of counseling, but I can go and tell my pharmacist, I know biologically he's a male and he's been given this medication. So then the pharmacist would have to go and talk to him, talk to the doctor, see what they can give him, and maybe give him something differently. We don't have to make a big production out of it, we don't have to make a big deal. The whole goal and the whole purpose is to give him the correct medication. And that's all that we're set out to do. So, handling our patients is something that we have to do every single day. And unfortunately, this is all just sexually based, biological. What about culture? What did we just hear about the Walgreens pharmacist? What did he do?
He used to give the medications if they're waiting for the abortion.
Yeah, refused to give them. That's his beliefs, that's his culture. That's what he was led to do. Can we say, oh, it's discrimination? In the state of Arizona, they said no, because it's his beliefs. It's his religious right. But I was reading as well about Muslims. The women, what do they do with their hair, with their face? They cover it. Do you know that males are more at risk of getting sicker than women? Do you think maybe it's because they're always covering their face and they're blocking all the germs?
Mm-hmm.
I also read about on our assignment about smoking. Is it frowned upon for women to smoke?
Yeah.
More than men, right?
Mm-hmm.
So who would you think would be more at risk of cancer? Men. Is that cultural or sexual? Cultural, right? That's all part of your gender. So it's totally different. It's not just because of the sexual, but also the cultural. Jehovah's Witnesses, religious based, do they get any blood transfusions whatsoever? No. We have to learn how to handle all of these patients when they do come towards us. So we gotta keep an eye on how to talk to them, how to be able to work around a way to where you don't give them the feeling like if you're judging them or anything in that sort of form, because then it's gonna be discriminatory based, right?
Or some cultures where the women aren't allowed to speak.
Exactly.
The men don't speak.
And we've actually had some, we would, in fact, Sam, you guys know Sam? But she's also had some where the husband has to translate everything for the wife. And if you say, yes, can I help you? No, she can't talk. You have to ask him to ask her to give the answer to him to give it to you.
Well, she was telling us that story. I remember that, and she was scared because she didn't know is he even relaying everything the right way or asking the type of questions that she actually needed to know. So.
Yeah, isn't that weird? So, us as pharmacy technicians, once we go out into the field, we're gonna have to learn to deal with all of that. It's not just sexually based, it's also gender based, cultural, everything, it's all in one little encompass little thingy. Ta-da! What do you guys think? Yay!